live in residential aged care often have dementia and they're at high risk of falling. So going to hospital with a hip fracture is quite common. And after a hip fracture, it's hard to recover.
My goals were to get this working. I tried to do it, but it got so hard, so easy to lie back and do nothing. I'm afraid that's what I did.
We want to be able to regain their functional ability as quickly or as soon as possible. Sometimes you only have a small window that you could do a successful rehab on someone with dementia. And the sooner you get them back on their feet, is the better.
We know that when we do research and ask people about the risk of falling again, many people say they would rather be dead than not walk again. So we have to help them.
We all work collaboratively to make sure that we look at every aspect, not only the transfer and mobility, we look at their dietary needs, their functional needs, their emotional needs as well.
If they see the familiar faces and understand that we're not going to let them down and that we're there for them and that every step we're there with them, and the confidence then starts to build. And the encouragement is that you're going to be okay. This is not the end of the world. We're going to get you going.
The staff here have been fantastic and they are very patient. I'm here every 2 days and they always ring, we chat about progress. Dad's always been a determined and a little bit stubborn person. They've been very supportive all the way along and given him lots and lots of encouragement.
Whenever we're trying to rehabilitate anyone, it's important to set goals. We then need to put in place the interventions that are going to allow us to achieve those goals, and we also need to be monitoring that the goals that we set we're actually achieving.
My grandmother, Peggy, was 97 when she broke her hip and was facing the first operation of her life.
Well, I didn't have very much idea, I thought, heavens, I hope they don't have to operate or something like that.
As a family, we immediately got together and set about creating some goals and aims that we wanted Grandma to achieve. First and foremost, it was keeping her out of any lifting equipment for as long as possible.
It's important to recognise the goal for them, the quality of life they're trying to achieve, and we can help them set something that is achievable. It may not be walking, it may be sitting in a wheelchair.
So if they're sitting up for meals, get them to sit up for meals. If they join activities in the communal areas or in the lounge room, get them to participate.
It may be stand transferring, all just to promote their dignity, to promote their socialisation and interaction with their environment.
But getting them back to their regular routine is the main thing.
Oh, they're marvellous, the staff. The way they help you and talk to you and tell you that you'll be all right and all that sort of thing.
I fell over and I had to try and manage to get back to normal, which took a while. Well, I didn't want to be a nuisance to everyone. I was quite willing to do everything they asked me to and things like that.
See, it's hurting now, but I'm forgetting about it because I'm talking to you.
He realises he probably won't walk again as such, but he can be much more mobile because he's able to be in that reclining wheelchair and be taken to lots of places, especially out in the cab, and see the rest of the world again now, which is wonderful.
Yes, I can walk all right. Oh, anywhere around here,
I get around with that. I can walk without it, but just in case of a fall.